Hello guys, I'm Ms. Annabeth Pamate. I'm going to tackle about the assessment of hematologic function and treatment modalities. So we have the 5 learning objectives, which is the first, describe the hematopoiesis and the process involved in maintaining hemostasis. So this is the hematopoiesis is the production of all types of blood cells, including formations, development, and the differentiations of blood cells. Prenatally, hematopoiesis occurs in the yolk sac, then in the liver, and lastly in bone marrow. And this process involved in maintaining the hemostasis is the process that stops the blood when an injury occurs. It involves the steps one. It involves first step is the vascular spasm. Second step, the platelet plug formation, and the last is the coagulation. So for the objective 2, we have the discuss the significance of the health history of the assessment of hematologic health. So this is when assessing your patient's hematologic system, it is important to ask the questions that reveal clues about the oxygen carrying capacity of the blood. Obtaining health history will assist you to identify any risk factors that could influence your patient's hematologic status. So the third objectives, we have the specify the proper techniques utilized, perform a comprehensive physical assessment of hematologic function. So in these objectives, the nurse should assess the hematologic function, which may include the oxygen carrying capacity of the blood. Requires the nurse to examine the patient's history, physical exam findings, and even the lab results of their complete blood count with differential. And for the fourth objectives, explain the diagnostic tests and related nursing implications used to evaluate hematologic function. So these objectives, the diagnostic test includes tests on blood protein, and blood producing organs. These tests can evaluate a variety of blood conditions, including infections, the anemia, um, the anemia, inflammation, hemophilia, blood clotting disorders, leukemia, and body's response to treatment. So the fifth objectives, identify therapies for blood disorders, including nursing implications for the administration of blood components. So the introduction of this, the hematology is the study of blood and blood-forming tissues. This includes the bone marrow, blood, spleen, and lymph system. A basic knowledge of hematology is useful in clinical settings to evaluate the patient's ability to transport oxygen and carbon dioxide, maintain intravascular volume, the patient's ability to coagulate blood, and combat infection. Assessment of the hematologic system is based on the patient's health history, physical examination, and results of diagnostic studies. And for the hematologic system, overview of anatomy and physiology, the structures of the hematologic or the hematopoietic system include the blood vessels, and blood-forming organs, which is the bone marrow, spleen, liver, lymph nodes, and thymus gland. So the Hematologic system also plays an important role in hormone transport, the inflammatory and immune responses, temperature regulation, fluid electrolyte balance, and acid-base balance. So this is the hematologic system consists of the blood and the sites where blood is produced, including the bone marrow and the reticuloendothelial system, which is the also known as the RES. Blood is a specialized organ that differs from other organs in that it exists in a fluid state. So the plasma is the fluid portion of blood. It contains various proteins such as the albumin, globulin, fibrinogen, and other factors necessary for clotting, as well as the electrolytes, waste products, and nutrients. So, and the next is the structure and function of the hematologic system as the blood. The blood is the cellular components of blood consists of three primary cell types, which is the erythrocytes, also known as the red blood cells or the RBC, the leukocyte, also known as the white blood cells or the WBCs, and the last is thrombocytes and known as the platelets. So the blood is a constant circulating fluid providing the body with nutrition, oxygen, and waste removal. Blood is mostly liquid with numerous cells and proteins suspended in it, making blood thicker than pure water, and the average person has about 5 liters or the more than a gallon of blood. The major function of white blood cells or the leukocyte is to fight infection because the white blood cells are part of the body's immune system. They help the body fight infection and other diseases by ingesting foreign materials and cellular debris by destroying infectious agents and cancer cells. And for the neutrophil is essential in preventing the limiting bacterial infection via phagocytosis because the neutrophil is the polyponuclear and phagocytic leukocyte that compromise the first line of host immune response against invading pathogens. And for the monocyte is entering tissues as macrophage. It is critical component of the innate immune system. They are the source of many other vital elements of the immune system, such as macrophage and dendritic cells. Monocytes plays a role in both the inflammatory and anti-inflammatory process to take place during the immune system. And the eosinophil is involving the allergic reactions and digest the foreign protein because it is the major effector cells in the immune system. They have a beneficial role in host defense against nematodes and other parasitic infections, and these are active participants in many immune responses. However, eosinophils can also be damaging as part of the inflammatory process of allergy diseases. The next one is the basophil. Basophil are containing histamine, integral part of hypersensitivity reaction, and it plays a part in immune surveillance. This means they have the ability to help detect and destroy some early cancer cells. Another important function of basophils that they release the histamine in their granules during the during an allergic reaction or asthma attack. For the lymphocyte, is the integral component of immune system because the lymphocytes are cells that determine the specificity of the immune response to infectious microorganisms and other foreign substances. And for the T lymphocyte is responsible for cell-mediated immunity, recognize materials as foreign because these T cells are a part of the immune system that focus on specific foreign particles rather than generally attack any antigens. The T cells or the T lymphocyte circulate until they encounter their specific antigen. As such, T cells plays a critical part in immunity to foreign substances. While for the B lymphocyte, it is responsible for humoral immunity and to produce antibody. They participate in the humoral immune response. This means they react to foreign antigens and differentiate into plasma cells. Our cells once activate, plasma cells are antibody-forming cells. And the next is the plasma cell. Plasma cells are secreting the immunoglobulin, most mature from B cells. These plasma cells are differentiate B lymphocytes, white blood cells capable of secreting immunoglobulin or antibody. These cells play a significant role in the adaptive immune response, namely being the main cells responsible for humoral immunity. The RBC, or known as the erythrocyte. This RBC carries hemoglobin to provide oxygen to tissues. Average lifespan is 120 days. The red blood cell, known as the erythrocytes. It delivers oxygen to the tissues in your body. Oxygen turns into energy and your tissues release carbon dioxide. And the platelets or the thrombocytes are the fragments of megakaryocyte, provides basis for coagulation to occur, maintains hemostasis, and the average lifespan is 10. This platelet is prevent hemorrhage from defects in the blood vessels wall by forming an aggregate at the site of injury. The next is bone marrow. The bone marrow is the site of hematopoiesis or blood cell formation in adults. Blood cell formation is usually limited to the pelvis, ribs, vertebrae, and cerebellum. Marrow is one of the largest organs of the body, making up 4% to 5% of total body weight. The bone marrow is found in the center of most bones and has many blood vessels. These are two types of bone marrow, the red and yellow. So for the red marrow contains blood stem cells that can become red blood cells. And the white blood cells or known as the platelets. So this marrow is highly vascular. Within it are primitive cells called the stem cells. The stem cells have the ability to self-replace, thereby ensuring continuous supplies of stem cells throughout the life cycle. And for the physiology of bone marrow is richly innervated and highly vascularized tissues of the body response of hematopoiesis. The major functions include transporting oxygen, defense against foreign invasions, and hemostasis. While the pathophysiology of bone marrow is the failure includes the first destruction of hematopoietic stem cells as a result of injury drugs, chemicals, rotation virus, or the autoimmune mechanism. Second, premature senescence and the apoptosis of hematopoietic stem cells as the result of genetic mutations and ineffective hematopoiesis. The next one is the blood cells. Blood cells has the erythrocytes, or which called the red blood cells. The erythrocytes, the normal erythrocyte is a biconcave disc that reassembles a soft ball compressed between two fingers. This is also mature erythrocytes consist primarily of hemoglobin, which contains iron and make up 95% of the cell mass. The next one is the erythropoiesis. Erythropoiesis arises from the primitive myeloid stem cells in bone marrow. This erythropoiesis is an immune this is the immune nucleated cell that gradually loses in nucleus. At this stage, the cell is known as the reticulocytes. The erythropoiesis is the process which produces red blood cells, which is the development from erythropoietin stem cell for mature red blood cells stimulated depressed oxygen in circulation, which is detected by the kidneys, which when secrete the hormone erythropoietin. The next one is the iron stores and metabolism. The average daily diet in the United States contains 10 to 15 milligrams of elemental iron, but only 1 to 2.5 milligrams of ingested iron is normally absorbed from the small intestine, according to Adamson 2015. The rate of iron absorption is regulated by the amount of iron already stored in the body and by the rate of erythrocyte production. The human iron metabolism, the set of chemical reactions that maintain human hemostasis of iron at the systemic acid cellular level in the body is a critical important part of many aspects of human health and diseases. And the concentration of iron blood is normally about 50 to 150 pg, according to Adamson and Longo 2015. With iron deficiency, bone marrow iron stores are rapidly depleted. So the next is the vitamin B12 and folate metabolism. The vitamin B12 and folate are required for the synthesis of the deoxyribonucleic acid, or the DNA, in RBCs. Both vitamin B12 and folate are derived from the diet. Folate is absorbed in the proximal small intestine, but only small amounts and stored within the body. The folic acid works closely with vitamin B12 in making red blood cells and helps iron functions properly in the body. Vitamin B9 works with vitamin B6 and B12 and other nutrients in controlling the blood vessels of the amino acid homocysteine. And next is red blood cell destruction. The red blood cell destruction has the average lifespan of normal circulating erythrocyte is 120 days. as I said earlier, aged erythrocytes lost their elasticity and become trapped in small blood vessels and the spleen. They are removed from the body of reticuloendothelial cells, particularly in the liver and the spleen. Red blood cells may be destroyed due to an autoimmune problem in which the immune mistakenly see your own red blood cells as foreign substance and them destroy them. Genetic defects within the red cells such as the sickle cell anemia, the thalassemia, and the GCPD deficiency. For the electrolytes are divided into two general categories, which is the granulites and lymphocytes. In normal blood, the total leukocyte count is 4,000 to 11,000 cells mm3. Of these, approximately 60% to 80% are granulites and 20% to 40% are lymphocytes. And for the leukocytes are part of the body's immune system. They help the body fight infections and other diseases. Types of leukocytes are granulites, neutrophils, the eosinophils, and basophils. Monocytes and lymphocytes are the T cells and B cells. For the granulites are definitely by the presence of granules in the cytoplasm of the cell. Granulites are divided into three main subgroups, which is the eosinophils, basophils, and neutrophils, that are characterized by the staining properties of these granules. A type of immune cells that has granules are the small particles with enzymes that are released during infectious, allergic reactions, and asthma. Neutrophils, the eosinophils, and basophils are granulites. A granulite is a type of white blood cells, also called granular leukocytes, or the PMN and polymorph nuclear leukocyte. The third and most numerous cells in the cells is the neutrophil, with granules that stain in a pink to violet hue. Neutrophils are also called the polymorph nuclear neutrophils, or the PMNs, or polys, or segmented neutrophils, which is the SEGs. Monocytes. The monocytes, also called the mononuclear leukocyte. These are the leukocytes with a single lobe nucleus and granule-free cytoplasm, hence the term agranulocyte. In normal adult blood, monocytes account for approximately 5% of the total leukocytes. Monocytes are the largest of the leukocytes. A monocyte is a type of white blood cell and a type of phagocyte. It is enlarged blood cells. Blood contains many types of cells: white blood cells, monocytes, lymphocytes, neutrophils, eosinophils, basophils, and macrophage. So these are the white blood cells. Red blood cells are the erythrocytes and platelets. Lymphocytes. Mature lymphocytes are small cells with scanty cytoplasm. Immature lymphocytes are produced in the marrow from the lymphoid stem cells. And a second source of production is the thymus. Cells derived from the thymus are known as the T lymphocytes or T cells. Those derived from the marrow can also be The T cells are more commonly B lymphocytes or the B cells. Function of the leukocytes protect the body from invasion by bacteria and other foreign entries. The major function of neutrophils is phagocytosis. Neutrophils arrive at given site within 1 hour after the onset and inflammatory reaction and initiate phagocytosis, but they are short-lived. The white blood cells are also called the leukocytes, as I said earlier. They protect you against illness and diseases. Think of white blood cells as your immunity cells. In a sense, they are always at war. They flow through your bloodstream to fight viruses, bacteria, and other foreign invaders that threaten your health. And for the platelets are which called the thrombocytes, are the technically cells, rather they are granule fragments of giant cells in the bone marrow called megakaryocytes. The platelets or the thrombocytes are small colorless cell fragments in our body that form clots and stop off preventing bleeding. The platelets are made in our bone marrow, these sponge-like tissues inside our bones. And bone marrow contains stem cells that develop into red blood cells, white blood cells, and platelets. So the next is the plasma and plasma protein. These are after cellular elements are removed from blood. The remaining liquid proportion is called the plasma. More than 90% of plasma is water. The remainder consists of primarily of plasma proteins, clotting factors, which particularly fibrinogen, and small amounts of other substances such as the nutrients, enzymes, and the waste products, also the gases. The principal difference between the plasma and the extracellular fluid of these tissues is the high protein content of the plasma. Plasma protein exerts as osmotic effect by which water and tends to move from other extracellular fluid of the plasma. The albumin. Albumin is the particularly important for maintenance of fluid balance within the vascular system. Capillary walls are impermeable to albumin. So its presence in the plasma creates as osmotic force that keeps fluid within the vascular space. The next one is the reticuloendothelial or the RES. So for this, the RES is composed of special tissue macrophage. When released from the marrow, monocytes spend a short time in the circulation, about 24 hours, and then enter the body tissues. The spleen is the site of activity for the most macrophage. Most of the spleen is the R75% is made of red pulp. Here, the blood enters the venous sinuses through capillaries that are surrounded by macrophage. The hemostasis. Hemostasis is the process of preventing blood loss from intact vessels and stopping bleeding from a severed vessel, which requires adequate numbers of functional platelets. Platelets nurture the endothelium and thereby maintain the structural integrity of the vessel wall. So the two processes are involved in arresting bleeding, primary and the secondary hemostasis. So the primary hemostasis are the platelet plug formation, and for the secondary hemostasis, this is the coagulation cascade. The goal of both primary and secondary hemostasis is to arrest bleeding from damage of the blood vessels or hemoblood. The stasis is standing. It also counterbalance valve action, which prevent blood coagulation in injured vessels and maintain the blood at fluid state. So the balance between procoagulants and anticoagulants. Four overlapping process or stages. First, local vasoconstriction. Second, formation of a platelet plug. Third is the formation of the web of fibrin proteins that penetrate and surround the platelet plug, blood coagulation or clotting. Last is the clot retraction. And the next is we have the gerontologic considerations. In older adults, the bone marrow's ability to respond to the body's need for blood cells, such as the erythrocytes, leukocytes, and platelets, may be decreased, resulting in leukemia, or a decreased number of circulating leukoplakin. For the gerontologic consideration, the older adult patients are at increased risk for complication of surgery, anesthesia due to increased likelihood of coexisting conditions, aging heart pulmonary system, decreased hemostatic mechanism, change in response to drugs, anesthesia agents due to aging changes, also the decreased renal function, and changes in body composition of fat or the water. Gerontologic considerations, also if older clients is hypotensive, plan for limited activities during the hour following eating for the frequent smaller food consumption throughout the day. More profound responses to cardiovascular medications than younger adults. So that's all for my topic.
Health history. So it is a record of health information about a person and his or her close relatives. So the personal medical history includes the informations about the patient's allergy, illness, surgeries, immunization, and also the information of medicine taken. This can provide important information related to hematologic diagnostic. The genetic in nursing practice is the abbreviation in the structures or functions of the blood cells or blood clotting mechanism. We have the autosomal dominant, means it is a pattern of inheritance characteristic of some genetic disease. Under this, we have factor V Leiden, a mutation of one of the clotting factors in the blood, and mutation itself does not have any specific treatment. Next is the familial hypercholesterolemia. It is a genetic disorder caused by the defect of chromosomes 19, The defect makes the body unable to remove the low-density lipoprotein and cholesterol from the blood. Familial hypercholesterolemia has no specific treatment. The next one is the hereditary angioedema. It is a disorder characterized by the recurrent episodes of severe swelling. Most common area of the body to develop swelling are limbs, face, the intestinal tract, and airway. So causes of this by improper functions of a protein called the C1 inhibitor. It affects the blood vessels. The next one is the hereditary spherocytosis. Hereditary spherocytosis is a condition that affects the red blood cells. People with this condition typically experience a shortage of the red blood cells count known as anemia, yellowing of the eye and skin, jaundice, and the enlargement of the spleen known as the splenomegaly. Causes by the defect of the erythrocytes membrane. Treatment for this is individual may require transfusion of folic acid administration and full or partial splenectomy or cholecystectomy. The other one is the von Willebrand disease. It is a blood disorder in which the blood does not clot properly. This is a current disease with no proper treatment. The other one is the autosomal recessive. Autosomal recessive is one of the several ways that trait disorder or disease can be passed down through the families. Under this, we have the chromatosis. Chromatosis is an iron overload. It's a condition in which your body stores too much iron, where it can cause serious damage to your body, including your heart, liver, and pancreas. You can prevent this disease, but early diagnosis and treatment can avoid and slow or reverse the organ damage. Other one is known as sickle cell anemia. It's an inherited red blood cells disorder in which there aren't enough healthy red blood cells to carry enough oxygen to your body. The treatment for this includes bone marrow transplant, the only cure for the SCD. Next is the thalassemia. Thalassemia is an inherited red blood cells disorder that causes your body to have less hemoglobin than normal. Treatment for this, bone marrow and stem cell transplant from a compatible related donor. The other one is the hemophilia. Hemophilia is an inherited bleeding disorder in which blood does not clot properly. This can lead to specious bleeding, the following injury or surgery. The best way to treat hemophilia is to replace the missing blood clotting factor done by injecting the treatment products into a person's vein. Nursing assessment. For the family history assessment specific to hematologic disorder, first you have to collect family history information on maternal and parental relatives from 3 generations of the family, and assess the family history for often family members with history of blood disorders. The next one, if a family history or personal risk is suspected, the person should be carefully screened for bleeding disorders prior to surgical procedure. So, next is patient assessment specific to hematologic disorder. First, assess for the specific symptoms of the hematologic disorder. Extreme fatigue is the common symptoms. Delayed clotting of blood, easy or deep bruising, abnormal bleeding, like for example, frequent nosebleed, and abdominal pain, known hemochromatosis, or joint pain, known as sickle cell. After After that, review the RBC count for abnormalities and assess of illness despite of low risk for the illness. Next is the physical assessment. For the physical assessment, in skin must be gray, tan, bronze, or patchy in color. And there are some potential indications for the hematologic disorder. For oral, ulcerations of the oral mucosa, angular sclerosis, enlarged of gum. For lymph nodes, enlarged site, respiratory, increased rate and depth, cardiovascular, distended neck vein, hypotension and hypertension, genitourinary, hematuria and proteinuria, musculoskeletal back pain and swelling. For the abdominal, you have the enlargement of spleen or enlargements of the liver. For the CNS or the central nervous system, the cranial nerve dysfunction and the senologic, like menorrhage. Diagnostic tests. The most common tests are used is the CBC, the complete blood count, which identifies the total number of cells as well as the hemoglobin. The next one is the peripheral blood smear. It is a procedure in which the sample blood is viewed to count the different circulating of the RBC.
So this video, I'm going to discuss the therapeutic approaches to hematology disorders. So the first thing is splenectomy. So splenectomy means it's a surgical procedure to remove your spleen. And what is spleen? So spleen is an organ that sits under your cage on the upper left side of your abdomen. It can help fight infection, filters unneeded materials such as old and damaged blood cells in the blood. Then also the spleen is a piece organ that helps keeping blood flowing into the liver. And the spleen is very important of your body defense against germs. So when remove the spleen, it does not work, you are higher risk of infection. So when the spleen removed, the surgeons perform a splenectomy. So the most common complications of splenectomy, infections, particularly pulmonary and abdominal sepsis. So majority of the complications of mortality rate from post-operative sepsis is substantial. So atelectasis, pancreatitis or fistula, pulmonary embolisms, and bleeding at the operative site. Also relatively common occurrences following splenic removal. So the possible complications of splenectomy include the usual risks of all surgery and injury to the surrounding abdominal organs. So proceed to laparoscopic splenectomy. So this is associated with decreased post-operative mobility compared to splenectomy. So post-operative complications include atelectasis, pneumonia, abdominal detention, and abscess formation. So for laparoscopic splenectomy is the gold standard procedure to remove your spleen. So in elective patients, but remain by very delicate procedure to fragility of parenchyma and capture of the spleen and its close connection with stomach, pancreas, and colon. So for removing your spleen, is majority surgery leaves you with a compromised immune system. For this reason, it's only performed when truly necessary. So the benefits of splenectomy are that it can resolve several health issues such as blood disease, cancer, and infections that could not be related any other way. So for the therapeutic apresis, Greek word aspiration. So for the therapeutic apresis is an extracorporeal treatment that is selectively remove abnormal cells or substances in the blood. It can also be used to administer cell or plasma constituents that are present in subtherapeutic concentration. So for the hematologic stem cell transplantation or HSCT is a therapeutic modality that offers the possible cure for some patients with hematologic disorders such as plasma, anemia, and leukemia, and thalassemia. It can also provide longer remissions from disease when care is possible, such multiple myeloma. So for hematopoietic stem can immature cells that can develop into all types of blood, including white blood cells, red blood cells, and platelets. So hematopoietic stem cells are found in the peripheral blood in the bone marrow. So and also hematopoietic stem cell transplantation is a treatment some types of cancer and other diseases. Stem cells can come from blood or bone marrow. Stem cells are not differential cells. They can develop into various specialist cells in the body. So therapeutic phlebotomy is the removal of a certain amount of blood under control conditions. So therapeutic phlebotomy is the preferred treatment for blood disorders in which the removal of red blood or serums is the most efficient method for managing the symptoms and complications. So these are the blood component therapy. Single unit of whole blood contain 400 ml of blood and 550 ml of an anticoagulant, and also is special preparations for compositions of plasma. These are so that's for the therapeutic approaches to hematology.
Hello everyone, I am Hazra J. Sabadin. So for today, I'm going to discuss my topic, which is the last objective of our report. So, procuring blood and blood products. Blood donation. All prospective donors are examined and interviewed before they are allowed to donate their blood. So to protect both the donor and the recipients, the blood donor must examine and interviewed before they are allowed to or undergo to donate their blood. He or she must in good health condition to meet the following criteria. So the blood donor must be healthy. So here are the qualifications that the donors must have. Body weight should be at least 50 kg or 110 labs for a standard 450 ml donation. So the body weight must be 50 kg, and the standard minimum of the blood donation is 450 ml for the 50 kilograms. Then the next one is people younger than 17 years require parental consent in some states. So in some states, there are the age 17 below, they must have the parents' consent before they are allowed to donate their blood. The next one is the oral temperature should not exceed 37.5 degrees Celsius or 99.6 degree Fahrenheit. Then the next one is the systolic arterial blood pressure should be 80 to 180 mmHg, and the diastolic pressure should be 50 to 100 mmHg. Then the next one is the hemoglobin level should be at least 12.5 g per dl or deciliter. The one donation could save 3 lives. So one donation could be saved 3 lives. So the average of RBC transfusion is 3 pins or 3 whole blood donation. Each unit you donate, about 1 pin, can be divided into 3 primary components: the RBC, plasma, and platelets. There are 3 types of blood donation, which is directed donation, standard donations, and autologous donations. So the directed donation, these blood donations are referred to as directed donations. This method is referred to direct donation. This type of blood donation is not any safer because many of them are not willingly identify themselves having a history of risk factors that they may have a disease. That they can be disqualified from donating. That's why many blood centers are no longer accepting the blood donations. So this type of blood donation are no longer accepted because some of them are telling lies so that they can donate. Then the next one is standard donation. Standard donation is phlebotomy, consists of venipuncture and blood withdrawal. So these methods of blood donation are use of standard precautions. So standard precaution, this must be in a clean or a sepsis sterile that donors must place in a semi-recumbent position. So specimens from the blood are tested to detect the infections and to identify the specified blood type. So specimen must be the specimen that donated the blood, it must be identified also so that they can be identified the blood type. And also the next one is autologous donation. Autologous donation, this method is a preoperative donation, the patient's own blood to be used for the future transfusion, example or orthopedic surgery. It should be collected 4 to 6 weeks before the surgery. So before the surgery starts. That's why patient must be monitored. They must be monitored for their own condition. So there are 4 types of blood donors. These are voluntary donors, replacement donors, autologous blood donor, and apheresis donor. So voluntary donors donate blood on their own. Replacement donors, it is from within the patient's own family or community. So the rest is you can see at the presentation. So next topic is transfusion. Administering of blood and blood components requires knowledge of correct administration techniques and possible complications. So it is very important to be familiar with the agency's policies and procedures for the transfusion therapy. So it is really important. There's method in each transfusion for blood components are presented in chart 32/2 and 32/3. For example, transfusion of back RBC before directed to the procedures, it must be requires a requires a pre-procedures, then follow up by the procedures, and last is the post-procedures. You can see at the chart 32-2 and 32-3. And also for the platelets or fresh frozen plasma, so the same as the RBC. Then the next one is setting. Most blood transfusions are performed in the acute care settings and sometimes must be done emergently. However, the process utilized to ensure safe transfusions of blood cannot be abridged for the sake of rapidity, but all the procedural details must be also followed, including obtaining informed consent. What if the patient does not consent to blood transfusion? So that's what the chart say. You can see that in a chart. And also the next one is the pre-transfusion. So the pre-transfusion we're going to assess the patient's history. We're going to know the patient's history of, so that we can know what will be the possible or the risk for the patients and the donors. Then the next one is the physical assessment. So we're going to assess the physical assessment of the donors, if he or she healthy or not. Then the next one is the patient education. Patient education is reviewing the signs and symptoms of a transfusion reaction. Is crucial for patients who have not received a previous transfusions. This is a brief review of signs and symptoms of transfusion reactions. Is advised. Signs and symptoms of reaction includes fever, chills, respiratory distress, low back pain, nausea, pain at the IV site, or anything unusual. Although a thorough review is very important for the nurses to reassure the patient that is carefully tested. So the nurse must be review the chart of the patient, if it is normal, and also if it is compatible to the recipients. Then the next one is the complications. Any patients who receive a blood transfusion is at risk for developing complications. Abnormal non-hemolytic reactions, such as abnormal acute hemolytic reactions, allergic reactions. That the rest are the complication for the patients that receiving the blood from the donors. That's are. Then, as you can see at the chart, there's a do's and don'ts after you donate the blood. Then the next one is the nursing management for transfusion reaction. If a transfusion reaction is suspected, then transfusion must be stopped immediately and the primary provider must be notified. So if any complication during the transfusion, the nurse must be tell or notified the primary care provider. That will be all. The next one is the intraoperative blood salvage. This method is for the patient that they can't afford to donate their own blood before the surgery. During a surgical procedure, blood lost in a sterile cavity. So during this must be an example. During the surgery, the own blood of the patient is sterile. That's why the use of the intraoperative blood salvage has decreased the needs of autologous donation, but has not affected the need of allogenic blood products, according to Blood Bank Mr. Commission. The next one is hemodilution. This transfusion method may be initiated before after induction of anesthesia. About 1 to 2 units of blood are removed from the patient through a venous or arterial line and simultaneously replaced with a colloid or crystalloid solutions. Patients who are at risk for myocardial injury should not be further stressed by hemodilution. So there are two types of hemodilution, which is the acute and non-acute normovolemic hemodilution. Then the next one is, we're going to proceed to the next discussion, which is the complication of blood donation. So these are the complications of the blood donation, which is excessive bleeding at the donor's beneficiary site is sometimes caused by a bleeding disorder, but more results from a technique error. So the next one is fainting may occur after blood donation and may be related to emotional factors, a vagal reaction, or prolonged fasting before donation. So that's the complication of the blood donation. The next one is anginal chest pain may be precipitated in patients with unsuspected coronary artery. Then the next one is the blood processing. So the blood processing, example of the unit of bloods are always taken immediately after donation, so that the blood can be typed and tested. Each donation must be tested for antibodies to human immune deficiency or virus or HIV. So samples of blood must be tested immediately, so that they can be able to know if there are some antibodies that present in the blood. The next one is the equally important is accurate determination of the blood type. So more than 200 antigens have been identified on the surface RBC membranes of this. The most important or for safe transfusion are the ABO and RH systems. So the next one is when a patient is immunocompromised, as in the case following stem cell transplant, any donor lymphocytes must be removed from the blood components. So we are going to proceed to the next topic.